Hi, this is Pam Taylor again, and you are at Blueprint to Success, Build Your Own Private Duty Agency. And I'm Pam Taylor, also known as Pam the Nurse, with Northstar Medical Consulting. There I am. About me, I am CEO and co-owner of Northstar Medical Consulting. I'm a registered nurse with a bachelor's degree and a certificate in public health nursing, as well as a continuing education provider for the state of California. And I'm an accredited consultant through ACHC, and I help other nurses to build their own agencies, their home health, hospice, private duties, and now home infusion therapy services. I am an educator on Home Health Academy, and that's where I write my courses and publish those online. I do have a nursing background. I've been a nurse for about 25 years, and I started in telemetry for 3 years, and it was at a county hospital. I then moved to everywhere. I floated everywhere, and really felt I went to ICU and liked that, but I ended up in ER and loved it in a trauma unit for about 3 or 4 years until I didn't love it anymore. Got a little burnout, well, a lot burnout on nursing, and I left bedside and went to home health. I've been here for almost 15 years and have not looked back. Just loved it from the time I came into it. So I settled over here on the California coast. I was a supervisor for a large accredited home health agency, and then became the director of patient care services, went to director of patient care services of a hospice agency, and then I started doing consulting. I had a really great background, started doing some consulting, and then started my own agency from the ground up. I've been consulting for gosh, I guess, how long are we going to say that's been? 2007, 8, 9, 10, 11, about 12 years. So I've been a consultant for a good long time. Took me a while to get accredited, but yeah, I was doing consulting one-on-one just through word of mouth. But when COVID hit, I decided to take everything I've learned and build a course around it. And this is it, Blueprint to Success. So that's how Northstar Medical Consulting was founded, and how I met you. So at Northstar, I built it to plan, optimize, and launch agencies. And like I said, I help nurses take their practice and build their own private duty agencies based kind of on their passion or what they love about nursing. I also am accredited for home health, for the Medicare accreditations, hospice accreditations, and then the home infusion therapy services program, which is now an accredited program. And so you are in the right place. If you're wondering about the Blueprint to Success program, and you're wanting to do a private duty startup, and perhaps you're in here to do the private duty and home infusion therapy services bundle. So you're wanting to get your agency first and then do the add-on of the HITS program. This first portion is a 9-week course, and afterwards, the HITS portion, if you bought that bundle, will be following this. All of this course material is accessible for 18 months. There is an expiration date on it, because the industry does change. And so this is an 18-month program. If you need to get a hold of me, you can always Facebook for general questions, or email me at pam@northstarmedicalconsulting.com. And you can schedule your one-on-one consultation. So what we do, we're nurses creating opportunities for other nurses and turning their passions into actual business models. Nurses are leaving the bedside like crazy and need a place to go and still want to do patient care, still love their practices, but are wanting to do it differently and kind of drive their own buses. So we're hoping to apply this, your business model to our blueprint program. And this blueprint gets you ready for, you may want to go for your state licensing and or you might be going for accreditation. You know, it's kind of depending on your plans, what state you live in, and what you're wanting to do. So we're going to go through some of that. So what I do is I prepare you for a survey and beyond. So you'll get your initial survey and I give you the tools for that. I give you concept and all of that. But you're going to get an ongoing survey every 2 to 3 years if you're licensed and or accredited. So I'm setting you up not just to pass survey one, but to actually have a great systems in place and concepts where you can pass subsequent surveys, you know, where you're not putting out fires all the time. So you never know too, you could get an unannounced survey. You know, someone could walk in and just do a survey, your state could. So that is what this program is for, to really get you ready to go, you know, proficient and well-ran organization. So our course is designed to be taught conceptually, the systems, the actual practical of running an agency, and then we're going off of the fine print or policies and procedures. So I teach this course conceptually. That is the master class. That's where we're going over module 1 through 9, and that is going to follow along with your teachable course. But this portion of it, the master class portion, is really concepts. It's really understanding the big picture, really getting a clear explanation of why you're doing what you're doing, because there's rules and regs to follow and there's systems to be managed, and you really need to be able to put it all together. So we do it conceptually. We have a system that is through your modules, and that is, you can access those 24/7. You're able to go online and into those modules are released every week. You're able to go in there and get your systems in place. There's an actual practical component too. To this program, you'll get your mock survey, and that mock survey, I walk you through the process of what you're going to face when your state survey comes up or your accrediting agency survey comes up. We go through that process together. So you have a clear understanding. I give you a great checklist of everything you're going to need. You're going to have binders, you're going to have folders, everything in place. Okay. So that's how we teach it. You do have fine print in policy and procedure, and the concepts, the systems, and the practices are all built around standards. Those standards, policies and procedures, your nursing standards and all of that. So this master class is through a Zoom link, and that is same time every week, and it's recorded and accessible for those 18 months. And there's questions and answers at the end. You can use the chat box and I'll get those answered. You also, with this program, have the Facebook group page. You can post general questions and answers on the Facebook group page. And also that is where I'll post maybe some licensing information, or the recorded master classes will be posted there so you can access them. And that Facebook page will be archived after we're all done with the course. I'll go in there and archive it. You'll have access again for 18 months. So you'll be able to go back, review material anytime you want. for 18 months. So recap on this. Um, the tools of this program is, why do I have hits here? Is should be private duty, but it's very much the same. We're going to get the master course to get a private duty practice running, and we'll give you the tools to start and accredit your agency. There's a weekly master class with Q&A at the end, Facebook group page where we share information, teachable course through Home Health Academy